Zoom room where we have from the FSM Association of Guam, Nadine Songeni and Dreama Asor here to kind of come on and talk about COVID awareness and outreach. Good morning, ladies.
Morning, Saranding.
Rananim. Nadine, I'm loving that. Is that a virtual background or are you laying down on the woven mat?
It's a virtual background, but it's very tempting.
It is, right? That's my favorite place to take a nap. So
Yeah.
we brought you on here. I know that Teresa, the consulate, had asked us to make some time to kind of get the message out, and we had I think Sam and was it Pat? I think on last week to kind of spread awareness with the rapid engagement team going on and doing testing and all that. So we got you here, and we'll just start. I give you the floor. Where are we at in terms of the outreach to the FAS and FSM communities on Guam, just about COVID-19?
Yeah. So we recently had a outreach at the Astumbo gym in Dedito last Saturday, and we had registered up to over 280 people. So we are waiting to get data back on how many actually showed up. But it was such a challenging task because this is us trying to reach communities that have majority of the communities we are trying to reach have less access, pure access to information being shared on the media, even social media, or even just traditional modes of communication like the phone. So it was really an effort with all the other members involved to contact or possibly drive by people's home and just let them know what's going on or let them know some of the options or opportunities. Just because we know that there's many of our citizens that work the front lines that are at essential businesses, so they continuously need to know what options there are in terms of testing or knowing what options there are should they become positive. And so we've had 2 outreaches so far. We're always planning to do what's the next step. So, but that's with the collaboration with the Department of Public Health and Social Services.
Right. So what was it like in this age of the COVID, and we're not supposed to be doing face to face, but at the end of the day, that's what it came down to, right? Was not social media, not traditional media. It came down to going into these areas, knocking on doors, and actually talking to people, right?
Yes, most definitely. That was one the biggest challenge with not only trying to combat the pandemic, but also in trying to really understand the way this virus spreads because of how we're very family oriented in trying to communicate or show our care for others. And so it's been really tricky, and we still continue to figure out different ways to not only reach out, but to share information. So even information sharing is very tricky at this point.
Right.
But definitely like being able to go on the news like here or other methods are just as helpful in the process.
Dreama?
Yes. Everything Nadine is saying is true. It's, she mentioned about family oriented and stuff like that. That's one of the challenges we are having in trying to spread the awareness and the mandate for the pandemic and the lockdown. And I think part of it is just putting yourself out there and being supportive to how embracing that culture or orientation, and also learning to
Adapt, right?
yes, adapt and also just spread the awareness to a lot of people. Like Nadine said, the communication is tricky, but getting this information out there and people being more aware of numbers and the changes in what the current situation is, it's helping people be more aware and be more conscious of the decisions they're making today.
And if I can add, part of what we're doing on the social media end is also the way that this information is being disseminated. So through partnerships or collaborations with the Micronesian Resource Center, who help translate these educational materials with public health or any other agency, right? So when our task, or at least with me, with social media or communications on the Facebook page, it's taking this information, but then also portraying them in the way that it's coming from a space of caring and respect, as opposed to like, here you go, take this and try to figure it out. So we do like, we've been doing some educational campaign just to be kind. And when you be kind, you're supporting others to recognize that this is a struggle that everyone is facing. And because we know the virus does not discriminate, nor should the way we help people be as discriminatory, you know? So it's being able to like kind of look at those kind of perspectives and be able to bridge those gaps of misunderstanding or miscommunication. So that's another thing on our end we've just been trying to do with this, not only awareness campaign, but also just socially responsible and socially engaged campaigns so that people know that we're coming from this place of care
Well, it looks like you guys have been gaining ground. I mean, just this past weekend, we heard from public health that 170 people had turned out to get tested at the Estumbo gym. And I know that when Sam was on a week ago, I want to say, he was talking about some of the misconceptions that people are scared to come out and get tested because they feel as though if they show up, they're going to get COVID when they go to the testing site, and that if they go and they test positive, they're going to be forced to go into a government isolation facility. But just looking at the numbers with the 170 people that turned up to the testing at Estumbo, it looks like, you guys are gaining ground. So, congratulations on that. But what are some of the other things, some of the other obstacles you guys are facing in getting the word out and spreading awareness?
Right. So I can share a little bit about just even as a program coordinator at Humanities Guam, where we do try to work with different communities, right? And one of the programs I do is the family literacy, and it's been a trend, or it's always exists that this issue with transportation. And so this is a community that continuously have this problem with transportation, and I think that's where, when public health needed to do the rapid door-to-door testing, kind of help bridge that. There was a little bit of, there was some sentiments, a little bit negative sentiments about it, but at the end, the bottom line was it reached a community that would have had a harder time to participate in these outreaches at places. Another fear, those are the main top fears, and it's not as surprising to me, because I want to say that those were the things I read on social media, nationally and locally. People, the way they were responding to going to testing, it's this fear of that's where you go and you'd actually get it, right? Especially if you feel fine. There's still confusion about being symptomatic and asymptomatic. So obviously that's also going through within our communities. Right. And so when you mix that all together, then you get people who just rather stay home, and then that's where it gets problematic when they feel like they had some symptoms, but because they're looking at a checklist, then if one doesn't check, then it's okay, I'm fine, and so it's just continuously needing to feel empowered to go get healthy or be aware. There's one thing about awareness, but there's also, at least through my perspective as a Chuukese, is being empowered to get better, because we're so used to, at least for me, growing up in the system, it's I have limited access to healthcare. So obviously I would fit one of the brackets of having underlying conditions or something, right. But I'm so used to not getting proper healthcare because I'm just relegated to very, small outreaches or the public health where it's, overwhelmed already with the majority population. And so those are other factors that come in, is people don't feel like they just are deserving of taking care of their health or being being noticed or seen.
Nadine, let me ask you. So there was a press conference a couple weeks ago where they kind of broke down the different ethnic groups that have a high infection rate. And so the first was the Caucasians. The second was, I think the way they categorized it was FSM community or FAS citizens. But I know that it didn't have so much to do with the ethnic group, but more of a socioeconomic categorization in terms of, multi-generational households. But, and speaking with some of my friends from the FSM community, they felt kind of hurt by that data. Was that what you had found, or did you kind of unpack it in a way where it's like it's about economics and not necessarily ethnicity?
It's, I feel like that's, it's always a challenge to like look at the facts versus kind of also how my own experiences. It's very related to one another. In terms of like the phrase multi-generational home, I remember when the first time I heard that word and I was helping with translating a document for public health, and it was just said that way. And for me to be able to like tell people that this is the reason that there's such a high spread is because, an example is I shared it with a family member to help me translate, and I said this is one of the reasons. They're like, are they accusing? It was coming from a place of being accused of, right? And so we're also talking about a population that continues to be stigmatized, whether in the media or on the street. And so it's very easy to feel very further stigmatized because of those data. It is the reality, but it's also something that many people, I don't think, have control over. And that's where I want to see more. There's just so much that we want to do, but we are also learning how to, at least for me, I'm still learning how to look at all those factors and see how I can come up with some sort of plan. But definitely there were some very hurt feelings and, like a little bit that it could have been done with a little more. Well, now I'm personally speaking, so I want to just kind of keep it more broad. But yeah, there were a little sentiments like that, but it really is the reality. And if people, and you're also looking at comparing the number of FAS to the population, so that's why it's even more alarming. And I remember the first time I heard it, I was like, oh my gosh, are they saying we're the contributing factor to this? And you had to I think I listened to one press release and Dr. David did clarify that it wasn't about looking at this one ethnic group contributing, and so for me, it was very key. But all I know is if it wasn't for listening to that end part of the press conference, I wouldn't have caught that. I would have continued this assumption or perception that these are people who are contributing. And I will share, sorry, Dreama, but someone had shared, one of our community leaders shared that some of the real experiences of people going to work and being told, you should go back because all Chuukese has the virus, So that effect is just, as alarming and discouraging.
Yeah, what I took away from it too was that, I grew up in a multi-generational household, and I'm not from the FSM. So what I had taken was that it really is. I mean, there's just a whole broad community on Guam that just, obviously we're impoverished. There's many programs that are available on Guam because of the number of people we have living at and below the poverty level. What I wanted to do is maybe go back to the beginning of the pandemic. And I know that early on, public health had talked about kind of folding in FSM Association and the Consulate General in terms of translating a lot of the graphics, releases about COVID going on. Have you guys been satisfied with that effort, and are you a part of it even up to now?
Early on in the pandemic, and maybe because I have a very, I'm trying to be as helpful and involved as possible. And this is also with a full-time job and being a mom and kids are at home, right? So I will just say that I wasn't personally, I was not happy about it, or and I but I'm also thinking of all the other factors that are involved.
Right.
But as it did get more in sync, and they definitely did go to places like Micronesian Resource Center, which exists to help in that way. If it seemed to get better, but when I did have that one experience of translating one document, that's where I questioned that even the interpretations of some of these texts can be very it can be very I don't know what's the right word, you know I can't, I'm like so lost. The wording can be, in English it makes sense, but when you try to interpret it or translate
Right,
it,
yeah.
it could be very condescending, or it can be very, so at least my task was to make sure that as I'm translating it or interpreting it, it's done again from the perspective of being respectful, but also being, caring.
Right.
And that's for me, that it takes a lot more time to do that. I mean, it was just like a page, and it took me almost more than a day, just so that I want to make sure that I'm translating it in the way that when people read it or receive it, they're not being accused, or they're not being, it's not condescending.
Right.
But
Lost in translation, I
hard.
think, is the
Lost
term.
in translation,
Right,
exactly.
yeah. And because it's
so-
Western, these are like Western ideals, and then when you try it, you can't just superimpose it over our island lifestyle, right? That's why a lot of what they try and tell us is, oh, it's our culture, it's preying on our culture. So yeah, definitely see the challenges there. What about further outreach? And do we know anything about maybe the rapid engagement team? We've heard some things that they might be heading out into other neighborhoods. Do you guys know anything about that?
No, and so people from the consulate couldn't make it on this morning because they just, I'll put a plug in for them. They just reopened their office, so they're open for curbside with appointments only.
Wow.
And so they would be better suited to answer this. But from what I know, we are engaged with public health to plan more outreaches, and it seems like rapid door-to-door is on the table to discuss. So it's a matter of being able to utilize those resources and maximize those resources. So even on our end, we gotta make sure that we're that's factored in, but also the reality of the communities that we continue to help. And so I can't stress that enough. Like, we on our end at the association, we could try 110%, but because of existing issues and factors, there's still going to be a low turnout rate. And we're just trying our best, and we hope that more people are aware of that, and they feel more comfortable in reaching out to us and letting us know what exactly are those issues, so that we can kind of put it together in a way that we have an action plan to address those issues. Because there's things that we hear, like, that people direct at us, like those fears, things that Sam mentioned. So personally, like, I've had to talk to people just in depth about, like, okay, if you do this, do that, or if this happens to you, we're here for you. And it kind of encourages more people to be to take action for themselves, to go get tested, or to not feel like there'll be consequences for taking care of themselves.
Right,
Like, that's
right.
another thing.
Yeah.
Well, I know we spoke with Janella from Public Health yesterday, and she was mentioning that the next deployment of the rapid engagement team, they're eyeing Dedito, and they're in discussions with the mayor there. So once we get information, we'll let you know. Or if you get information, let us know.
Yeah, I'm always for collaboration. I mean, if all these different agencies, if they do similar work, why not come together to execute it or implement it, as opposed to, like, and that's where I come in too, is from a nonprofit perspective, is that collaboration really is key to implementation, and even strengthening what our objectives.
Yes, and I think the more we spread in this communication and information, it makes this abnormalcy be more normal for everyone, and it kind of alleviates or eases the fear to a certain degree. And I mean, I've had people come to me in like in confusion saying, you know, what is this with the high rise or spread in the Chuukese community, and it further confusion and why is the Chuukese population separated from the FAS counts. And it's just a matter of letting them know, like, when you further isolate the Chuukese numbers from the FAS count, that number will be higher because it's a smaller population, ratio.
Right.
So, yeah.
You know, this is kind of a not really random and totally relevant, but have you guys heard from Cas Nakamura? Because I'd spoken to the wife a few weeks back, and she said that he was, and she allowed me to share the information that he was hospitalized, COVID. Have you heard from him? Is he doing okay? Is there anything you can tell us?
Yes, he's posting on Facebook every day now, praising
Okay.
God.
Woo! All right, good. Because I tried to call him.
Yes.
I think you can send him a friend request.
I don't even really go around Facebook that much, but okay. Okay, now I will. All right. Well, that's good.
I will add though, like, it's so helpful, and it's so also, it just feels so good to be able to be who we are, look the way we are, that we do, and then be talking like this as we're trying to combat this pandemic and even the perceptions that come with this pandemic. Because I remember when kind of looking at some of the press conferences, and I remember feeling one of the presentations, I was like, I've never heard Chuukese like said or expressed like 10 times in one sentence. And I remember thinking, like, but they've never also mentioned how Chuukese are also, helping in this battle.
Right.
And it definitely makes a difference if there was some mention that FSM Association, at a more visible point of view,
Right.
that we're helping in that. And so there was another post that we did just to kind of bring that awareness that there are so many FAS or Micronesians who are helping in different capacities.
Right. Yeah.
And it makes such a difference when a person like me listens to the news and we're told we see it in this light, and if there's no recognition of the people also involved in that same battle, then it can be discouraging and disheartening. So
You're right.
I really appreciate this opportunity to talk in this manner, that we're just not, the issue. We're part of the solution.
Right.
Yeah, I think that's important, because when you only hear half of the story, the natural thought for a lot of people is to say, hey, well, what are they doing to help themselves? Or, they. So it's definitely good to show that you guys are out here, Zori on the ground, knocking on doors, you know what I mean? And just so we've just had so many people from the FAS, FSM communities on the show. I mean, even way back when it was containing COVID. So we know that definitely you guys have been on the front lines of the outreach. And just also when we talk about essential businesses, I mean, these restaurants open, who do you guys think is cooking your lunch? You know what I mean? Right?
Yeah. So
I mean,
it's
so
that,
definitely
and
front line all the way.
yeah.
Well, thank you guys for coming on.
Thank you guys for having us. We so appreciate
Thank
it.
you so much for having us.
Anytime.
All right. You got our number. You got our Zoom link. Jump in anytime, Kay. If we're doing another rapid engagement team deployment, if you want to come on, just shoot us a text and we'll get you right on, okay?
All right. Thank you so much.
We're going to let you off without the slam poetry, but next time I want a little slam poetry,
Next
okay?
time, we'll prepare.
Okay, make sure. Right. Okay. We'll see you, Dreama. Thank you. Nadine, thank you so much.
Well, we
Thanks,
got
guys.
snacks.
Bye.
Okay,
Oh,
so.
we got snacks for him.
Oh, we do. We have virtual mana tatitas.
Oh,
Coconut,
awesome.
yeah, there's some butter there, guys. Take it easy on the butter, though, okay? Yeah. Come back. We'll have Tanala Kutney. I'll make it for you, okay?
Ah.
Okay.
Thanks, Nadine.
I never thought about Tanala Kutney for breakfast, Jay. Thank you.